building up of tensions between the US and China, also their competition for influence in the Pacific Islands. I mean, he's basically challenging the notion that armed conflict is inevitable between these two powers, and believes all the external powers of the region, also including Japan and Australia and others, that they are just asserting their national interests, economic interests. You know, and regarding the recent nuclear submarine deal, the AUKUS Pact, Panuelo says there's nothing new about that alliance, and that the biggest news really is just that there's simply another acronym at large, while regional security is strengthened as Australia gets access to newer technology. But of course, that doesn't necessarily quell concerns about the interoperability of nuclear-powered subs.
The Federated States of Micronesia, it's quite a small country. I mean, does it have much influence in the region?
Well, just limited. It is a small country in terms of land mass, but in total area, its waters span something like 260,000 square kilometres. And Micronesia is placed in a key strategic region, really, just north of Papua New Guinea, east of the Philippines, so really quite close to the region where tensions are up, and proximity to, vital shipping lanes and big fisheries. And the other thing is the FSM has relations with both US and China, unlike most of the other independent Micronesian countries who recognise Taiwan. So it's in a position to talk to these governments, and Panuelo says Micronesia has total faith and confidence in all parties to keep the Pacific region safe.
Yeah, you mentioned its relationship with the US. I understand the president has recently held talks with US defence chiefs in Hawaii. Is that right?
That's right. And it hasn't gone unnoticed by the media. Panuelo says the talks were misconstrued by various media outlets into headlines that the Federated States of Micronesia is set to become a US military base. Instead, he says the outcome of the talks really were more about boosting US Coast Guard help for them to tackle illegal fishing in the region, which is a big problem and dents their economic livelihood and so forth. But Panuelo says all this talk of conflict just distracts from the biggest issue, climate change. And he thinks all these, powers, US, China, Japan, Australia and others need to make climate change a separate, non-political matter for cooperation. So on that front, he's really anticipating some big commitments need to be made by the international community in Glasgow in just over a week or so.
Kia ora, Johnny. That's RNZ Pacific's Johnny Blades. And finally, Miss France, the country's 101-year-old beauty pageant, is being sued over some apparently discriminatory entry requirements. A 2021 application form for the national pageant shows candidates won't be considered if they're not at least 5'5", or if they've ever been married or had children. The group Dare to be Feminist says Miss France contestants perform a work service and should therefore be protected from prejudice under French employment law. Further disqualifiers for potential contestants include wearing weaves or hair extensions, having tattoos or smoking. And that is World Watch for today. I'm Max Toll. Mani?
Kia ora, Max, and koina te purongo o te paututanga o Oturu o Whiringa Anaku. That is us for today, Thursday, October the 21st. We'll be back tomorrow, of course, with interviews and the latest news from Aotearoa and the world. But for now, from the midday team, kia tau, te mauri, kia pai tō koutou rā. RNZ News at 1. Whakalofalahi atu. Good afternoon. I'm Marama Tipole. We'll be crossing to Parliament shortly for the daily COVID update, today with the Deputy Prime Minister Grant Robertson and the Director of Public Health Caroline McElnay. Until then, here are the top stories. The British High Commissioner says New Zealand's track record of trade innovation made it a priority for the UK to establish a free trade deal. The deal will eventually wipe tariffs on all New Zealand exports, saving exporters an estimated $38 million a year, and is the country's first bilateral deal to include climate change provisions. Laura Clark told Midday Report it's a unique deal that includes an Indigenous trade chapter, high standards around animal welfare and climate sustainability. New Zealand is the second country after Australia to secure a free trade deal with the UK post-Brexit. Physiotherapists say
Dr. Bloomfield to update on case numbers and other related matters, and then we'll come back to me with a very brief comment and then your questions, aiming to, in light of the House and obligations there, aiming to finish around about 22. Dr. Bloomfield.
Thank you, Deputy Prime Minister. Kia ora koutou katoa. So today we're announcing 102 new COVID cases in the community. Of these, 94 are in Auckland and 8 of them are in the Waikato. So our total number of cases in this outbreak is now 2,260. Of today's cases, 30 are household contacts, 40 are yet to be linked to a current case, although you can imagine with this number of cases, interviews on many are just getting underway or about to happen. Now, of yesterday's cases, the 20 remain unlinked at this point, with investigations ongoing. But the focus, of course, is on identifying contacts and isolating and testing those contacts. Today we've got 46 people in hospital, our highest number in the outbreak to date. 45 of those are in hospitals across Tamaki Makaurau, and 1 is in Waikato Hospital. It's becoming increasingly clear, as has been the case right through the outbreak, that COVID is internationally a disease amongst the unvaccinated, and this is certainly the pattern here. The harms of COVID-19 fall much more on those who are unimmunised. A BMJ study which was released just last month, based on UK data, shows that of 40,000 patients hospitalised in the 6 months to the middle of this year in the UK, 84% of those people hospitalised had not been vaccinated, and only 3% of cases in hospital were fully vaccinated. Our own figures are similar here. We still have just 3 of our 188 people hospitalised during this outbreak, just 1.6%, who are fully immunised. That is at least 2 weeks since their second vaccination. And fully immunised cases make up just 4.5% of the total. So, further evidence from here and also from the UK that vaccination is an excellent way to protect you, your whānau, and of course the community. Testing also remains important. Yesterday, 12,759 swabs were taken in Auckland, and 26,669 tests processed around the country. Every one of these tests is important for us keeping COVID under control. So thank you to all those involved in swabbing and processing the tests. Testing available right across Auckland today again, and a reminder that anyone with symptoms, even if they are mild and even if you have been vaccinated, and in particular in New Lynn and the North Shore suburbs of Rosedale, Red Vale and Bayswater, where the positivity rates were a bit higher over the last few days, please get tested as soon as possible. But anywhere in Tamaki Makaurau, please get tested and isolate until you receive your result. The 8 new cases in Waikato are all around the Te Awa Mutu. 7 have already been linked to known cases. Waikato DHB is continuing testing across the region, and there were over 3,000 swabs taken yesterday. However, we would like to see higher testing numbers in and around Te Awa Mutu. Please get tested if you have symptoms, if you have a household member who has symptoms, or if in the course of the last week or so you have travelled in and out of Te Awa Mutu for work or for other essential activities. Whether you have symptoms or not, please get a test. One of today's cases in Waikato was a permitted traveller with an exemption to travel to Napier last Friday, the 15th of October. They were not a confirmed case during their travel and subsequently turned positive when they returned to the Waikato, where they are isolating at home. Their infectious period included the time they travelled to Hawke's Bay. There were 2 close contacts identified, one of whom lives in Wairoa. However, both have now returned negative tests, so there's no risk of onward infection there. They will, as close contacts, of course, be kept in isolation for the full 14-day period and retested on day 12. I'd like to just reiterate there are no positive COVID-19 cases in Hawke's Bay, and thank you to those involved in this situation for their excellent support. The Ministry's updated guidance for allied health professionals working in settings outside of district health boards and hospitals, clarifying that they can provide services under Alert Level 3, that would be in Auckland and the Waikato. This clarification enables roughly 2,000 allied health professionals, such as physiotherapists, chiropractors, osteopaths, in Auckland, that's just in Auckland alone, to see patients who need to be seen face-to-face and to provide appropriate treatment. Of course, they will be screening patients for COVID symptoms, practicing COVID-19 IPC measures, including distancing where appropriate, strict protocols around infection control, PPE use, scanning and so on. They will also keep providing telehealth services where that's most appropriate. So I do want to thank our allied health professionals who have had to adapt their practice right through the course of the outbreak, and particularly in Tāmaki Makaurau over the last 2 months. Finally, it is timely infection prevention control this week, and I'd like to acknowledge the huge effort and dedication of our IPC professionals, especially the nurse specialists and others in the health workforce who strive to prevent infections. That ongoing work has been particularly front of mind during the pandemic over the last 20 months, and of course has been a lesson for all of us in the general public about what we can do to prevent infections spreading, including, and most importantly, not going out or to work or anywhere if you are unwell. Back to you, DPM.
Thank you very much, Dr. Bloomfield. Just before I take questions, I do want to say something about the case numbers. I know for people who watch the 1 o'clock briefing, it is something that you follow closely, and the ups and downs can be a bit of an emotional roller coaster. You will have heard from all of us who've spoken from here recently that we can expect to see case numbers rise. We do still want to keep them under control, and we're working hard to do that, and we thank Aucklanders for their cooperation in doing so, and as we head towards the long weekend, do ask Aucklanders to continue to stick to those Alert Level 3 rules. While keeping a lid on case numbers is important to reducing hospital admissions and reducing pressure on our health system, case numbers in and of themselves are not the only measure that we need to use going forward to assess the severity of the outbreak. It's anticipated that in the future 95% of people who get COVID could be treated at home with appropriate community care. And indeed in this outbreak, only a small percentage of those who've contracted the virus have ended up in hospital. The bottom line here, though, is that the vaccine is the key to keeping you, your family and your community safe. We are facing this outbreak with higher rates of vaccination than perhaps others have in other countries. We are in a strong position, but we do need to build on that and see more people be vaccinated. So today, that means that we need to look at the number of cases and do all we can to keep them under control, but also keep an eye on hospitalisations so that we're measuring the severity of the outbreak there. The safety and health of New Zealanders remains at the forefront of our mind, and it is how we will continue to focus on managing the outbreak.
What plans are in place for hospitals that do get overwhelmed with COVID cases? 100 today, what are we going to see tomorrow? Well,
again, I make the point that just because we have 100 cases today, that doesn't mean 100 people going to hospital. In fact, far from it. What we have been planning for the whole of the outbreak is making sure that the health system can cope. New Zealand's health system is staffed by highly trained, dedicated professionals. Dr. Bloomfield, who I'll turn to in a moment, through the Ministry of Health, works with the DHBs. We've shared workforce from around the country to make sure that people can be given time off, to make sure we get the right speciality in the right place. Today, we have, I think it is 6 people in ICU, so the number of people in ICU is keeping reasonably steady, and so ICU capacity is not an issue for us at this time. And overall, the hospitals have been planning for this. That's what they do. But Dr. Bloomfield, can you add to that?
Just to add to that, one of the things we've been doing, obviously, for the last 2 months is supporting the Auckland DHBs with staff coming from around the country. The hospitalisation numbers, the ICU bed use numbers are consistent with what our modelling suggested and consistent with the case numbers, so they're very much in line. And we, of course, would not let ourselves get to a position where our hospitals were overwhelmed. The key thing here is how we use the resource that is available in the hospitals, but also in the community through our primary care providers to look after as many people as possible outside of hospital.
And Dr. Bloomfield, are you still confident in schools opening next week given that surge in case numbers today?
Of course, it's always a balance between the potential risk of infection spreading, but also the other health, social and educational needs of the students. Our assessment for a while has been that it is safe to open those schools. I think a number of measures have been put in place, including reducing the number of students by confining it to years 11 to 13, the use of strict infection prevention control, mandatory use of masks, and we also know, especially in Tamaki Makaurau, we've got quite good vaccination rates in our 12 to 18-year-olds, and so that's really encouraging as well. It will require, again, one of the key things is any student who is unwell should not, or staff member should not go to school. We'll keep a close eye on that through until the end of Labour weekend and give some final advice if there's any change in that.
And just to add on to that, we would not have taken the decision if we didn't do it on the basis of both good advice and good safety measures. And so, as the Director General's just said, we're making sure that infection prevention measures are front of mind for all schools. Obviously, we have teachers being vaccinated. We want students to be vaccinated. Some schools are now deciding that they want to pick that up themselves as well. All of that is positive. But we're talking here about a cohort of students between years 11 and year 13 who are coming up to some really important parts of their schooling journey, and we wanted to make sure we could facilitate that in a safe way. We don't have year 9 and 10 students, and we certainly don't have primary school students returning at this time. So we always look at risks. We always look at the balance of making sure we get that right. Jenna.
How concerned are you about the growing number of unlinked cases, and are any of today's unlinked cases in the Waikato?
There was just the one that hadn't been linked yet in the Waikato, but I suspect as interviews take place that will change. The other 7 were all contacts.
How concerning is the growing number of unlinked cases? Are you kind of reaching the point where the contact tracers are starting to feel immense pressure?
Can I just comment on that? It's to be expected, and it's by virtue of the nature of the outbreak and also the numbers. But again, at this point in the outbreak in Auckland, the focus is not so much on trying to link the cases. It's the most important information is to try and find out who the contacts might be of those cases and get those people tested and isolated. And that's been the focus really for the last week or two of our contact tracing efforts. The contact tracing is just as intensive and just as timely as it has been right through.
Can I just add one thing to that, Jenna, to that answer too, is that throughout this outbreak, we've been making sure that we share the burden around public health units around New Zealand. And so particular clusters of cases have been managed by public health units outside of Auckland throughout the outbreak. And we're very conscious of the fact that the contact tracing team in Auckland are doing a great job for us. So we are spreading that load around. But as Dr. Bloomfield said, what they're focused on at the moment is getting to contacts. The linking and so on is no longer the most important job that they've got.
I guess the converse argument from epidemiologists to that would be if you don't know where it's come from, you don't know if there is an undetected chain of transmission. So isn't that step just as important as finding ongoing transmission from one solo case?
Well, at this point in the outbreak, the key response there is high rates of testing to continue and finding cases. It's right from the start of the outbreak. Every case, of course, is another one to add to the numbers, but we want to find the cases. Likewise, the modelling that we get updated from Auckland every day does look and see if there are likely to be large numbers of undetected cases in the community, and the latest modelling shows no, it's a pretty good match. So our sense at the moment is we are finding most of the cases out there.
Do you have a sense of, or estimates of how many more cases there could be based on the contacts, both in Waikato and Auckland, which you have reported before?
In Auckland, it's simply we're too far into the outbreak now, and the numbers are too large for us to be able to keep a track of that. In Waikato, we do know that there are all the close contacts have been identified. All the family close contacts have been identified. For some of the close contacts, We don't have a good indication of all of those, but we are using the cases to sort of spread the word around their networks to ask people to get tested. And it's, in a way, it's good to see the testing numbers coming through, and we are identifying these cases, so that approach is working well.
I'll just be clear that, we with the Waikato cluster, effectively, it is much more one that we can see, that we can identify. We have to work through with people to make sure we're getting all of that information, but I think I distinguish the two quite significantly from here.
Do you have an estimate then of how many more cases there could be in the Waikato?
Oh, well, I don't have that in front of me here today, but there undoubtedly will be more cases in the Waikato because we have people and they have households, and we know that that's how it spreads. But our attempt by having the measures we've got in place in the Waikato is to be able to continue to try to stamp out this outbreak, and we're taking the approach we're taking because we believe we can do that.
I'll come back to you on that. It was something we were doing earlier on with the smaller number of cases in Auckland, so we'll separate out the Waikato cases and just see how many potential household and other close contacts
just
there are.
Just going to come across here
and the conversion rate.
To Derek, and then
just following on from that, can you tell us how many unlinked cases there are currently in the Waikato and where they are spread, and if there are any active cases, I think outside of Raglan, Hamilton and Te Awa Mutu?
Yes, so the 8 cases from yesterday were all around the Te Awa Mutu area, 7 in Te Awa Mutu, 1 in Kihikihi. 7 have already been are already known to be linked. The other one is being interviewed, but there's a strong sense that there will be a link there. The only cases that I understand that have been unlinked were the 2 actually in Hamilton from about a week ago. They're still they've been linked through the whole genome sequencing. It's very clear, but the epidemiological link hasn't been able to be made yet.
Derek, I'll let you do what would have been your other question too.
I wanted to ask about how often is the wastewater testing being done around the country? Obviously, as there are more cases in Auckland, the chances of it leaking out, there should be more focus on that. Can you tell us how often the wastewater is being tested around the country?
It varies around the country, and my understanding is there's a dashboard on the ESR website. I think it's the same dashboard I get that shows wastewater testing results on a daily basis from around the country. Most places it's weekly, some twice weekly. I guess we're at a point in the outbreak in Auckland where probably the wastewater testing is of less use because we know it's just going to keep returning positive right across the city. So we will be increasing the frequency across the Waikato over the coming week or two, just to, again, identify whether there may be detections in some of those smaller towns around the Waikato.
And in recent days, in the last week within the Waikato area, there's been an increase in testing, wastewater testing, just as there was in Northland as well. And so there's regular testing around the country, and then we hone in on areas where we believe that we need to do even more regular testing.
Should that be more frequent around the country than once a week?
Well, it's obviously something we can look at. I wouldn't rule out trying to increase it. We take advice from the ministry. We've used wastewater testing in the way that I've just described throughout the pandemic, and we'll continue to use it as we're asked to. There's certainly no resource constraint or anything like that around it, or anything that's delaying it.
Mr. Herkins has talked about the likelihood of it spreading around the country, and we obviously want to find it, if it does, as soon as possible. So.
And there is regular wastewater testing around the country. It's not that there's none, but I take your point.
As opposed to
I take your point that you're suggesting should we just up it everywhere. The advice that we continue to get from the ministry and others is that we should do regular testing and then focus in on hotspots.
Yeah, and we're looking at it again as part of a sort of future testing in a highly vaccinated population, including which tests the sort of surveillance testing of the population, but also the wastewater testing, and that may well see us doing the latter more frequently as part of the disease detection, really early detection over this, after about a month from now when we move into a highly vaccinated population.
We'll get them to Jason.
Director General, we've got information to suggest that somebody at one of the MIQ facilities in Albany had left the facility and then came back later in the day, or later after a period of being out in the community. Have you got any information?
No, I haven't heard any information.
No, haven't heard that one, Jason.
We
can follow that one up for you, though.
And just as a punt, the initial case that launched Delta into New Zealand, where are we with that? Have you found anything to suggest where that came from? I know it's been a while, or is that trail completely cold now?
The trail went cold, and so we obviously focused our resources on managing the outbreak. So we did look very hard there, but weren't we've got a really good idea of, we know which hotel it came from, which person, and pretty much which day, but just how it jumped across the border there, as it were, has not been.
And that's not uncommon, that in these sorts of things, we have a lot of information about it, but in the end, the absolute 100% confirmed link wasn't able to be made. Joe?
Just on the Allied Health announcement today, there's been calls for a long time, particularly for people who get regular physio treatment. Why has it taken so long to decide that this is safe to do?
Well, the Ministry's been working really closely with the professional bodies, and in many senses it was a clarification of what is permitted under Alert Level 3. And early on in an outbreak, when certainly in Auckland we're trying to effectively stamp it out and get back to zero, the controls under Alert Level 4 and the first part of Alert Level 3 were designed to minimise contact between health professionals and people as much as possible. It's now reached a point, and certainly talking with our DHB colleagues up there, that enabling access to some of these allied health services in the community will help with conditions progressing to a point where they might need hospital care, and we've also worked out with those professions exactly how they can ensure that they and the people they're treating remain safe.
Minister, last week I think Sam asked you about whether you give any consideration to expediting the proactive release of this public health advice. Have you had any conversations with the Prime Minister or Cabinet colleagues about that?
I did, after we spoke, have a conversation upstairs. I'll have to follow up on what happened with that, because I wasn't resolved. Yeah.
Dr. McElnay said last week that about 170 to 180 cases was that point where our health system was starting to would get a bit of pressure put on it. Do you have any indication if New Zealand may start to look at getting those kind of numbers each day? Is there any modelling to suggest that?
I'll give Dr. Bloomfield a chance to respond to that, but I was standing here when that happened, and I do think the context is important, which is that there's a difference between, in terms of the earlier question, there's a difference between how we manage pressure in the system and whether or not it is manageable. And we do believe that it is manageable, but as we obviously get to a greater number of cases, particularly a greater number of hospitalisations, then hospitals have to start managing their resources. And that is the process that they've been planning for some time. And this has been, this is common in other situations we've faced in New Zealand when you get a very large outbreak of the flu, or you have other reasons why. Hospitals have systems to allow themselves to be able to move resources around. So I think that's what Dr. McElnay was referring to, that once you got up to hospitalisations at around a higher level that would be driven by a higher caseload, then hospitals would begin to start moving their resources around.
Yeah, two comments here, and I wasn't on the podium, of course, but I think it was particularly talking about the pressure on the contact tracing system, but it's opposite as well to the healthcare system. At the moment, the R value is still 1.2 to 1.3, which means doubling about every 10 to 12 days. So that means we're likely to reach those case numbers perhaps in 2 to 3 weeks' time. What is most important is what proportion of those cases have been vaccinated, because that will be material in terms of how many require hospital care. So there are two things Aucklanders can do to take the pressure off our staff in the hospitals. One is get vaccinated, and two is continue to abide by the Alert Level 3 requirements.
Just on that, Monday's figures showed about 77% of people weren't vaccinated, including a fair chunk of them with children. About 50% weren't vaccinated. Are you anticipating to see those case numbers have a higher vaccination rate, just to try and reduce those hospitalisation levels?
Yes, and so actually we just saw some modelling from our colleagues in Auckland today showing that over the course of the outbreak in Auckland, the proportion of cases who are vaccinated is increasing. It's still by far the minority, and so next week we'll do a little bit of a show and tell on how this happens. Of course, as you get a highly vaccinated population, the greater the proportion of your cases will be vaccinated. But it does absolutely keep down the hospitalisations because they're much less likely to be hospitalised. As I said, only 1.7% of those hospitalised in this outbreak have been fully vaccinated.
And it's simply a function of maths in many ways, that the more people we see vaccinated, the more likely, as an outbreak grows, that you will see people in the outbreak who are vaccinated. But to reiterate Dr. Bloomfield's point, both at a personal level, being vaccinated means you're much less likely to get the virus, less likely to be sick with it, and far less likely, as we statistically know, to be hospitalised. And as I said in my introductory comments today, we're now looking at all of those measures in terms of how we measure this particular outbreak. I'll come down the front and then back up to Jim.
Thank you. So a question for Dr. Bloomfield. So I think it was yesterday, it was 86 cases they're isolating at home. Can we get an updated number on that, and whether, considering Māori and Pacifica are disproportionately harmed by Delta in this outbreak, whether there's any concerns, isolating people at home, considering the virus spread through unvaccinated larger households so far, whether that puts Māori and Pacifica more at risk in this regime?
Yes, so as of yesterday, I think by the end of the day, actually by the middle of the day, it was 101 people from 55 households who were isolating at home. There's both a public health and a clinical risk assessment done before people are sort of put into that stream, low risk sort of category of being able to isolate safely at home. And in particular, if people are in households where it's difficult for them to be separate from other household members, then that is almost directly then they go into, it's a category where they would be supported to go into a quarantine facility to avoid that what we've otherwise seen as quite a high rate of infection of family members.
Yep. I said to Gina, didn't I?
I've just got a question on behalf of the whānau of Sean Wainui.
Yeah.
They really want some of their family members who are stuck in Auckland to be able to travel down and support the rest of his whānau as they grieve. Why is that not allowed, and why are there such prescriptive rules around what constitutes an immediate family member?
Look, as you know, this has been one of the hardest things throughout COVID-19, and I've stood here and answered questions about it before, and it is a truly difficult area for both those who give us advice about how exemptions are granted and the government in terms of the rules that we set. And so throughout this period of time, there have been people who tragically have missed out on attending tangi and funerals, and it is very, very hard. The advice that we take, however, is around how we minimise risk. And the thing about funerals, weddings, those sorts of events, is they are one where people find it extremely difficult to socially or physically distance. And so it is a very, very difficult area. I know the ministry works through to try to find ways to be able to facilitate people there. It is challenged by the concept of tangihanga, because tangihanga implicitly involves a wider group of people, and so that makes it even more challenging. But we do know that this is a risk area for us. We try to manage it sensitively, but many people have unfortunately had to do that. Do you have anything to add, Dr. Bloomfield?
Just that I know our team looks at every application on its merit, and in fact we've extended the criteria for that sort of family relationship that does allow people to travel out, to include not just first degree relatives, but where there's whāngai type relationships as well. And they do look, and if people do ask for a review of it, and I think there was a request yesterday of that, then I asked the team to go back and have another look at it.
In this case, it's in Auntie, so have we put too much of a Pākehā lens on what constitutes immediate family?
Yeah.
Have we not taken a more cultural reference?
I believe that the ministry does take into account cultural factors, but in the end, there will always be a limit to numbers, and that is the issue that we are dealing
and
with.
And so, just aside from tangihanga, should there not be, I guess, some sympathy given and leniency given where whānau just do need the support of their wider family, with young children?
Yeah, look, my heart goes out to this whānau and to all of the others who have been through this. It is without doubt one of the most difficult areas of managing COVID-19. We try to do it sensitively, we try to do it safely, and I'm sure the ministry and others would have been assessing any application that way. Ben?
Do you agree with the quite morbid suggestion from Iwi Chesley, Mike Smith, who said that it will take Māori deaths to up the vaccination rate? And we did see that slightly after the AOG cluster.
I don't want to look at it that way. We've seen really good progress in multi-vaccination over the last few weeks. We've come through with significant increases. We are working every single day with every provider we can to make sure that we increase multi-vaccination rates. So I don't want to look at it that way. I want to look at it, as I know a lot of Māori do, on the basis of whakapapa, on the basis of how they can support their whānau and their wider community to be able to stay safe. And so I appreciate that there will be people with different views, but that's where I'm coming from.
I also asked, does the increased case count, does it expose the sort of folly of having one of these freedom days, as has been suggested by the opposition for December 1?
Well, it's certainly, putting yourself in a position where you say there needs to be a certain percentage, but there's also a so-called Freedom Day, seems to me to be a somewhat contradictory position. What we need here is to get vaccination rates as high as we possibly can across as many parts of our community as we possibly can. And everybody would love it if you could set a date with COVID that everything would be over, but that simply isn't how the virus works. I understand the frustration that sits behind that, but actually the strong advice we've had is it's about vaccination rates. I'll come to Jason, and just before I do, I can say that I got a message to say there's no truth to that rumour, and there are in fact no MIQ facilities in Albany.
Makes sense.
Have a question.
On, is the decision for Cabinet tomorrow still around the Waikato? Is that still on the agenda?
So the advice we'll get, the public health risk assessment that we'll get from the Ministry of Health is likely to come through later this afternoon, and so ministers will attempt to assess that as quickly as we can so that we can give certainty to the people of Waikato as soon as we can. We're likely to try and announce that possibly this afternoon. That won't mean another press conference, just to reassure you of that. It will be likely done by a media release as soon as we get the information. It's just there's a timing issue. Dr. Bloomfield and his team provide their advice, and then it works its way through to us as ministers. So we are conscious of the fact that people in the Waikato will want certainty, in which case we'll try to do it this evening.
Is there going to be a cabinet meeting, or is it just...
There's a group of cabinet ministers who are given power to act on these matters, and we can meet in a number of forms. We meet virtually, we meet in person, so we'll be able to manage that. We'll go to Henry. He hasn't had a question.
Minister, have you seen the news about the warehouse looking to require vaccination for all staff? Are you happy about that? And do you think that basically every retail store could probably make the same, retail chain could probably make the same kind of calculus and say, we've got to be in contact with people. We also think a safe working environment is needed, thus require our staff to be vaccinated.
It's clear that a number of businesses have been working their way through this and working out both their legal obligations, but also assessing the health and safety of their workforce and of their customers. If you go on the WorkSafe website today, you'll find a risk assessment tool that you can use as an employer as to whether or not you should be vaccinating or your staff should be vaccinating. A big part of that risk assessment tool is about public facing and the fact that if you are in that position, that would justify from a health and safety perspective you deciding that you wanted all of your staff to be vaccinated. In terms of the broader issue, work's been going on between government ministers, business groups and unions to discuss how we will move forward from here to provide the maximum amount of certainty that we can. I think everyone will appreciate it's a relatively new area for employment law, and so people are treading carefully, but that work is progressing. In the meantime, as I say, there is actually a risk assessment tool, and I'm not going to comment specifically on the warehouse, but certainly where you have a lot of public-facing staff, you can look at that tool and see that from a health and safety perspective, you're likely to want to have vaccinated staff.
I feel that will drive the vaccine rate up, because after Super Saturday we've seen 3 days of 10k first doses and about 32k second doses, which is one of the lowest weeks we've had basically since August. Looks like things are dropping off.
Yeah, well, obviously, and as we get to higher rates of vaccination, we get to people who are perhaps more hesitant or harder for us to reach, and so it's not a huge surprise in the absence of a major effort like Super Saturday that it will sit around there. We are now applying all the resources we can to reaching those people. To answer the first part of your question, I welcome anything that lifts vaccination rates. I think more people talking about the importance of it, not just from the health and safety of you individually, but the people you work with, the community that you're around, is a good thing.
Do you do you have sympathy for the business owners who are asking for a law change?
Yeah.
They just say they don't want to be in court. And currently, obviously, there's this risk assessment tool, but that seems like it could be challenging.
Yeah, look, you know, these are, whenever you get into matters of employment law, anything potentially becomes challengeable, and I have no doubt at some point there will be legal cases in this area. Around the world, you can see them happening. The work that ministers are doing is to give as much clarity as we can. We are very aware of those employers who are telling us, please just mandate this. We've also got ones who don't want that as well. And so we have to make sure that we have a legal framework that is robust. Discussions about that are happening, and I'm sure there'll be more to say soon. Jane.
I think legislation would be a step too far. I mean, National on its plan said that, you know, if legislation was necessary to give that certainty to businesses, then that's what they would do. Do you not think that's necessary, or do you just not want to put it into the statute books and have it, you know, in that kind of form?
As I said in my answer I just gave to Henry, this is evolving and evolving quickly, and you can look around the world at examples that have gone either way. What I think the most important thing is certainty. Now, if certainty can be delivered by legislation, that's one thing. If there are other ways of doing it, we should look at that as well. We do need both employers and employees to be able to come along with this. And if we, I know, you know, we're in the middle of this now, but if we all took a step backwards and just for a moment considered that's the kind of employment law change we would be considering, it's a big step. We're in the middle of a pandemic. Big steps are things that we've had to do, but we just have to make sure we work through so we don't put ourselves in the position that Henry just mentioned of being in court.
Yeah, I mean, the government's potentially in the gun as well, isn't it, in terms
Correct.
of legal testing? Is there anything on the horizon, you know, that could be the test case for it? There must be.
Well, we're certainly not looking to take the case, but look, I mean, again, the only reason I mentioned that is because if you look around the world, that's what's happened, and so I would not be at all surprised. But we are working through that process. I do welcome as many people as possible being vaccinated, and obviously, as I say, right now, people could take a look at that risk assessment tool and make a pretty good judgment.
Active challenges against government.
I'm not aware of anything right now today, no. Derek.
I just want to clarify, so there might be a decision on Waikato's alert level setting today, elected this afternoon?
Potentially. The only reason I say that is because we want to make sure we give people in the Waikato as much notice as possible. And I think
the Prime Minister said on Monday it was going to come on Friday.
That's right. It's because the public health advice gets delivered today, and we don't want to delay. We sometimes get criticised in this room if we sit on a decision for a short length of time, and so ministers, when we were briefly discussing matters earlier this morning, concluded that if the Director General provided his advice to us today and we can make a decision today, then we should do that.
I wanted to ask the worker who went to the Hawke's Bay, who later tested positive, do you know their vaccination status?
I don't, and it was a person who, it was a permitted activity related to childcare arrangements. I don't know about their vaccination status, but just to reiterate that they had returned back to the Waikato before they became a case. I do know that one of the two contacts in the Hawke's Bay was fully vaccinated, but as I said, both of those people have returned negative day 6 tests.
Any more thought to mandatory vaccination for people leaving the boundary?
Not lately. I mean, it's an ongoing process, and we never rule out the idea that we may go there. We continue to listen to the advice we get. I'm conscious of our time, so I'm just going to take a couple more. Joe, here and here.
You're talking about the ongoing need for the difficult ones to now get vaccinated. Does it bother you that in South Taranaki, for example, there has been a plea from iwi who run Māori Health Services there for a caravan type style from Taranaki DHB for a number of months now, and they finally got granted it yesterday because Māori vaccination became such a talking point, and Minister Henare called out Taranaki DHB for being slack. Why does it take that sort of comment to prompt DHBs to actually deliver the services that Māori providers who know what they're doing on the ground actually need?
So I can't comment specifically on the Taranaki DHB in this instance. What I do know is that we've got really good examples around the country where we've seen tremendous collaboration between DHB, iwi and other Māori health providers, and we do have examples, as you note, that Minister Henare called out, where we don't. Our job right now is to make sure that we work with every single provider who can and help us lift those vaccination rates. I absolutely respect that there are Māori health providers around New Zealand who know their community well and they know their community in many ways a lot better than perhaps some of the people in the DHB do. We have to listen to them, but this won't work unless we're collaborating. The DHBs are vital cogs in this. They're under a lot of pressure, they're working very, very hard, but we can share the burden of that, and so I'm pleased that they've responded to Minister Hinare's call.
Dr. Bloomfield, just on that, have you been involved in that at all? I mean, the issues have been raised with you here many times, most of the time for me when it comes to Taranaki. Have you talked to the DHB? Has that prompted them to actually deliver these services, or what?
Well, I don't personally talk to the DHBs regularly, but my team does because they convene the senior responsible officers from all the DHBs more than once a week. I spoke yesterday actually with the CE of Taranaki, but that was after the decision had been taken, to say, what else do you need from us that would help you in your efforts there? And I was reassured by what I was told around what it had improved in terms of the working with and the relationships with the range of iwi providers there. So I know that's a real focus for them. I also had a conversation with the Chief Exec at Tairāwhiti yesterday.
I'm just going to, because of the time, I'm just going to take two more here and here.
Dr. Bloomfield, when will the border order be updated to recognise other vaccines for border workers such as Air New Zealand pilots?
I don't know exactly, but we'll come back to you on that. It's very close to being completed.
And whānau Order is claiming the Ministry of Health's delayed court proceedings in order to build their case. Why did you offer a proposal that was not the data set they'd asked for?
Well, I'm not going to comment on that because it's a process that's going to be, may still be before the court.
So I think we might just leave that one. We'll take the final one here.
Thank you. Just on travel documents. So has anything been done to tighten up the process after obviously those two women travelled out of, brought COVID to Northland? Has anything been done to tighten up how you...
So I believe I might have said it on the podium. So we went back and worked with MB in particular around how those business travel permits are granted. They are a process, a thorough process now of checking within particular categories as well. There was an element, as we know, of error, human error in what happened there. So processes and systems get constantly checked. I think I've said it a number of times before that, with the numbers of people who are moving, it is very tough. But each day I know that there is a group of people working really, really hard to make sure that they help keep New Zealanders safe by working through that permitting system. Every now and then there'll be a mistake. As soon as it happens, we correct it. Thanks, everyone.